Cook with Politics and How It Affects You, and I am here today with Paul Perry from Precinct 3. He's a county commissioner in Ellis County. How are you doing today?
I'm doing fine. How are you?
Good. And we are sitting our distance so everybody knows, and we have our hand sanitizer. So I wanted to just go over some numbers, Paul, before we start with the shelter-in-place order that was ordered last night by Judge Little. In the U.S. right now, in Texas, we have 920 confirmed cases of COVID-19, 12 fatalities. In the United States, we have 53,660 confirmed cases, 18,612 fatalities worldwide. There are 417,582 cases confirmed worldwide and 247 worldwide recoveries, which is pretty good. Now, I would just like to point out that tuberculosis kills 1.5 million every year, and it's a pandemic that has been going on for many years. The vaccine has not been available to all. Cancer kills in the millions. I think we were talking about this earlier. And influenza, how many deaths of influenza each year?
Dr. Court, I think, indicated there were over 20,000 so far this year, and I've heard that number other places.
Okay.
I know that I read the CDC site on influenza, which you can Google up, and I think year before last flu season was over 50,000 deaths, and then last year was 30,000 and something deaths. These are numbers. Is
this worldwide or just in the U.S.?
I believe those are U.S.
Okay.
I'm not sure.
So that's a lot. That's a lot.
Yeah,
we could get to that with.
Yeah, I mean, we can look this up. People can look that up, and they can judge for themselves.
I actually see 17 million people die every year of infectious diseases. So, and there are some vaccines, some not. I think you had mentioned 17 states are now under some sort of shelter-in-place order.
That's the latest record that I'm aware of.
Okay, and then 26 counties. It changes by the minute. 26 counties, 10 cities. South Carolina governor, for example, had said that we must all assume that we have it. So if there's more than 3 people gathering, police are allowed to break that up. It's not a shelter-in-order place.
And in all fairness, the media and everybody I've watched and listened to informed us all along that as testing increased, we'd see more cases. That doesn't mean we're seeing more severity.
Right.
It just means that there are more cases. Now, there's going to be a proportional increase in severe cases, but you know, when I looked at the numbers on that Princess, I think it was a Princess cruise line.
Yes.
There was 700 and something people that were infected out of probably several thousand on the cruise line, and then the death rate on those folks is a little over 1%, and included a higher age group than is in the population from the studies I read.
Okay.
You can look that up. I think that is on Johns Hopkins Coronavirus.
Okay.
And that's a great little site, because if you can bring that up, then there are some little tabs in the lower left-hand corner.
Okay.
And you can look at it by nation, and then by kind of political organization, province or state, and then you can even get it broken down by county.
Okay.
If you play with that site a little bit.
Okay.
So that's a great site. It's Johns Hopkins, and it's the coronavirus resource.
Okay, let's talk a little bit about Ellis. Okay, so Ellis County has 8 cases now and 1 death, and Dallas County.
We have a death?
There was a death in Maypearl, I believe. Was there?
No.
That was not true? Okay.
No,
See, this is why we want to tell the truth,
No,
and we have
as
the
of-
man who can do it. Tell me about
As of yesterday, there were no deaths.
There were
I'm
no
not
deaths,
aware of
okay.
any deaths.
Okay. And then in Dallas County, there was 155 people affected, I think 2 deaths. So
I was told by a medical professional that we only have 1 coronavirus in a bed
a hospital
in the
bed.
hospital
Right
now.
I think that's accurate.
And we have others being treated at home.
Mm-hmm.
We have other people who presented mild symptoms that could be coronavirus that they chose not to test. But I've also been told by a medical professional there's over 100 tests at the hospital now.
Okay.
So we're increasing our testing kits, and I suspect that as we increase tests, we will see more confirmed cases. But that doesn't necessarily mean that those are going to be severe cases.
And that doesn't mean that they're happening this week necessarily. And that's one of the things I think that when President Trump was speaking, his health, I don't remember what her title was, but she had said you're going to see the numbers increase because we're doing all these tests. So it's going to look like that for the first couple of weeks. So tell me a little bit then. So last night you guys ordered shelter in place in Ellis County, and so that was part of your commissioner's work.
I was comfortable, and it's a bit of a compromise for me, but I was comfortable with the governor's order
Yes.
which I think is clearer. And if we'd have wanted to increase restrictions, I think the governor's order would have been a better template because it was simpler. It was 2 pages versus
Yeah, you have the order here.
this is what was passed over my vote and Commissioner Grayson's vote, and I believe it's 9 pages. And it's an attempt, and I have to give credit. This is an attempt to make something clearer, but unfortunately what it does is by providing so much detail, I think it creates more questions
Yes.
than the other order would have. I mean, it would have been far more simple to say we're only going to allow so many people to work in a business other than specific protected industries, which we have, there's national, federal law that defines what is an essential industry.
Right, exactly.
So otherwise, we could have said, okay, you can have X number of people at your business, practice social distancing, whatever, and that leaves a situation where if somebody turns up positive, you can track the contacts.
Okay.
That's one of the issues. The hospitals and a lot of the medical profession is at least theoretically concerned that we could overwhelm our bed capacity if this thing really set in like in New York. But as we're finding out more and more, New York was a special circumstance because of the subway system,
Right.
because of people's reliance on public transportation, which in Texas I just do not see as a panacea for our travel issues.
Right.
I can certainly see a room for some public transportation in Texas in denser areas, but this is another example of where if we're going to have public transportation, we have to have risk mitigation in
Right.
the public transportation.
Exactly.
Now, I had some things thrown at me at court. Well, what if this saves one more life? Well, every year we lose thousands to the flu. So should we put in these orders every time we have a flu outbreak? And my answer would be no.
Okay.
And the flu doesn't scare people as much because they have a vaccine that is only somewhat effective for most strains of the flu. Now, I'm not an anti-vax person, although I think it's a personal choice issue. I do
Exactly.
get a flu vaccine on occasion, but not every year. I haven't had the flu in 6 years. It doesn't seem to be a huge risk for me. But I do get when I do get a flu vaccine, I get the strongest one I can get.
Right.
Okay.
I've never actually had a flu vaccine before.
Yeah, and that's a personal choice.
Right.
We're a free society,
Right.
and in a free society, unfortunately, we have to take risks
Yes.
to be a free society.
Yes,
And-
we have
and-
to take responsibility for ourselves instead of
Right.
telling the government, we want you to tell us what we need to do because we're too stupid to do it.
Yeah.
And that's what's kind of
Well,
happening.
my concern is that I think we're setting precedents
Yes.
that are going to be easier and easier to resort to. And I am opposed in general principles to government by emergency.
Yes. Okay.
I think government needs to be done on a logical and constitutional basis.
Right.
And I
right.
think if we're going to infringe on anybody's right, even if the Constitution allows some infringement in times of emergency, we need to be very cognizant of what we're doing, and we don't need to cause confusion with the public, which I think, unfortunately, we're going to add to that unintentionally with the order that I voted against.
Well, I think that too, that shelter in place versus stay at home, stay safe are supposedly two different things, but very confusing. So just in a nutshell, we only have about a minute and a half left. What is the difference between
Yeah,
shelter in place and stay at home, stay safe?
Bluntly, if you look through these, the terms are used different ways by different acts,
Okay.
and ours has a lot of places where you can.
Well,
do
there's 4
different things.
pages of essential people,
Yes.
and I think, people might be interested in
But
that.
I don't think those terms mean much, except it's the background, it's the body of the act that means something. So I don't, the terms themselves, just, that needs to get your attention, and everybody needs to read the order. It's available on the county website.
Okay, check out the website. We're going to be with you. We're going to do another show with Paul, and we're going to talk about some more interesting things, so you guys stay tuned. I'm Rita Cook. Thank you, Paul Perry. We are Politics and How It Affects You.
Appreciate the opportunity to serve.
Thank you.
Thank you.